Morning for women in their 30s and 40s specifically. Have you heard of something called SCAD? It's spontaneous coronary artery dissection, and it is most common in women who have no cardiovascular risk factors, women who are perfectly healthy. And because it happens so suddenly, many cardiologists are, quite frankly, and really primary care physicians are missing the diagnosis. Joining us now is Dr. Pamela Rama. She is a cardiologist with Baptist Health. Good morning to you. Always a pleasure to see you. Appreciate you coming in. I remember I was reading this morning. I thought, you know, I mean, I'm in the right age group, certainly. And the reality is that if you don't have, you know, any family history, I wouldn't think that someone my age would need to worry about this. What specifically causes SCAD?
Well, we don't know exactly what causes SCAD. What happens is that the inner layer or the inner lining of the coronary artery tears. And what happens is that there's fluid or the blood seeps in between the layers and causes a hematoma or bulging. Now, this bulging tends to basically obstruct the blood flow to the muscles, and that's how you get all of the problems with SCAD.
And this is something then that could happen very quickly. Are there typically then warning signs that a woman in particular would, because you mentioned 90% of this happens in women, so men don't have as much of a risk as women?
Yes, men don't, yes, but around 10% of men can still have it, but it's typically women. And the symptoms are sudden. So you typically don't have the angina that you have with coronary artery disease.
So let's talk about what those symptoms are then also, so that people know not to ignore them. I mean, and we've heard this before, at least with heart attack, chest pain. You know, and sometimes, particularly around the holidays, maybe you're eating foods that you don't normally. You could maybe confuse that with even just indigestion.
Right, but people describe this as a severe chest discomfort with associated symptoms. You know, you could have some sweatiness with this. People feel nauseated. They want to vomit. And sometimes it radiates all the way to the back or the arm or the neck.
It's interesting because we also heard maybe even jaw pain as well, shortness of breath.
Yes.
Can also be, you know, indications of this happening. You know, it's interesting, too, because as we were talking about this, there are women in particular who fit into this profile, pregnant women, who are at a higher risk.
And we think it's because of progesterone. There might be some effect of progesterone that weakens the lining of the coronary arteries that causes the tear.
So is this a case where if you are pregnant or thinking about getting pregnant, you're in that age group that you need to talk perhaps to your OBGYN about this risk and maybe seeing a cardiologist? Or you think that that's, you know, too, you know, I tend to be a worrier?
It's not necessarily, because the problem is that we really can't identify. We don't know much about the disease, so we can't identify the people who are going to have this event happen. So that's the dilemma here. Definitely, if you've had it before, the chances of you having it again is around 30%. So before getting pregnant, you're going to have to talk to your cardiologist about it.
And then also, once you have the baby, do your risks drop significantly, or are they still there for some months after?
No, the risk actually starts antepartum, so a couple of weeks before you give birth, up to 12 to 24 months after giving birth.
So is there then, as you mentioned, there really is a hormonal link here related to the progesterone, you think?
Yeah, we are suspecting that there is a hormonal link because around 20% of patients who have SCAD are either, you know, pregnant or during their menstrual cycle. We have seen that as well.
So then this is as much of an important information to get out, not only to women who are thinking about getting pregnant, for example, and in that age group of 30 to 40 years old, but it's also important, quite frankly, for even primary care physicians to not ignore these signs if a woman calls them, because you might just assume, since there are no risk factors, that this is something else.
Absolutely. Especially, you know, you don't think about coronary artery disease in patients who are young, especially childbearing. So this is something that you have to think about, especially if they come in with symptoms of chest discomfort.
Dr. Pam Rama, thank you very much. We appreciate you being here. Happy holidays to you and your family. If you missed any of this information, we will post it along with this entire interview later this morning on news4jax.com. Just look under the morning show page. Nikki?